Hello everyone, thank you so much for coming. Thank you to the center and thank you to the society for having me. It's a great honor to be here. And I am giving a talk about taking a pragmatic step forward in including evolutionary theory in public health programming. Now, I want to quickly describe what public health program planning is because I don't have any slides on that. Just to be very clear, any public health program is a program that is basically an intervention where you have a target population and a target problem, and you create a program or an intervention to relieve that health problem. Now, this can range from very, very small scale to a neighborhood, community, to a large scale national public health campaign. Typically, people who are creating these interventions are people who have MPHs in community health, sometimes epidemiology, sometimes health policy and management. And so that is who I'm kind of focusing on for this talk. Now, I think the first step in this is kind of distinguishing the difference between a problem that is mostly approached in a clinical setting, so one-on-one provider and patient, versus a problem that's typically approached with a public health setting. Now, the example of this that has been used many times to illustrate a public health problem that can be approached from an evolutionary perspective is the paper by Ruth Mace and Mari Gibson. And many of you are probably already familiar with this article, but for those of you who are not, I'm going to briefly explain it. And also this article by Karen Kramer and Garnick McMillan also illustrates the same phenomenon. The basic take-home point of this article is that there was an intervention that took place in rural Ethiopia that was aimed to decrease child malnutrition. And the first step was putting in water pumps in this rural village in Ethiopia. Now, overall, this meant that the women's energetic output decreased without changing any of the intake. So diet didn't change or nothing changed in terms of their energy intake. So what we saw as a result of that was actually increased fecundity and increased fertility, and not a increase in resources allocated to the children that they had. So this shows female energetics and human reproductive ecology in action, and shows that how the body basically decided, I'm anthropomorphizing for just illustrative purposes, chose to allocate that extra energy. Now, the implications of this are that had the intervention designers known about female energetics or human reproductive ecology, they could have potentially been able to inform the community of what changes might occur, or potentially have a culturally relevant family planning component of this intervention. Now, I'm jumping forward to a quick search that I did in the American Journal of Public Health with keywords of evolution and evolutionary. So as you may or may not be able to see from these slides, all of the articles are from the 1920s or 1940s, so not recent literature at all. And if they're not from the 1920s or 1940s, they are using the word evolution as another word for change or transition. We do a search for post-1990, and it doesn't really get any better. Now we do a search for epigenetics, and we see that there's plenty of literature on epigenetics. So what this tells us is there's kind of a little bit of a niche opening up where an evolutionary perspective might be able to come into play. Now, why public health? Public health programs have the potential for big impact on population health problems. And also public health is typically focused on both primary and secondary prevention of health problems. Public health is also very interdisciplinary in nature. Although it's mostly focused on proximate methods, mechanisms, and models, it borrows those from psychology, sociology, and lots of other fields in the social sciences. Now, this paper by Randy Nesse and Stephen Stearns has kind of opened up this path for looking at both evolution and medicine and public health from an evolutionary perspective, and kind of basically stated that it would be very hard to show every single type of way that evolutionary medicine can be useful to both clinicians and public health practitioners. But they did lay out a framework of asking two different sets of questions for clinicians. However, I would say that for public health, we may be able to create a tool that does separate evolutionary medicine into types or categories. And this is what I'd like to call the ISEMPH roadmap. So it will be an instructional tool that's aimed to aid paradigm shift and introduce an evolutionary perspective to public health program planners. And it will contain different types of evolutionary medicine or categories within evolutionary medicine. And it will be limited to problems. Under those categories, there will be problems that are where an evolutionary perspective will give the public health practitioner new and useful information that has the potential to change their intervention design or implementation. This is the preliminary model that I have for now. I think that these white boxes, there will be fewer of them when I'm finished with the model. But you can see here that there's several different categories or types of evolutionary medicine. This will be an interactive tool and also hopefully a publication in the American Journal for Public Health. And the interactive tool will be available for public health practitioners to use. And they will be able to click on each of the blue boxes to get a very, very basic raw introduction to each of these kinds of evolutionary medicine. And they will also be able to click on each white box for specific information about the literature that's been done on that public health problem, also experts who are currently studying that public health problem from an evolutionary perspective, and ideally, if there's any case studies for interventions that have either gone awry or done really well due to either unknowingly or knowingly taking this evolutionary perspective into account. We definitely have really great examples of this on risky adolescent behavior. Bruce Ellis has a wonderful article about risky adolescent behavior, evaluating different interventions that have both done well and not done well, or had the outcome that they intended to have. Now, directly applying this to public health, I'm going to introduce you to a framework that almost every public health practitioner is familiar with and uses. It's called PRECEDE-PROCEED. What public health practitioners typically do when they have a public health problem and a target population is they do a needs assessment. And they come up with an educational diagnosis and an environmental diagnosis. You will see that here on the two bars, there's different factors that go into play that might be contributing to a certain public health problem occurring in this population. Now, where this ISEMPH roadmap comes into play is if the public health practitioner is focusing on a problem that is in the roadmap, they will be able to receive information on this evolutionary perspective. And this might impact the way or the level at which they intend to intervene. Finishing up early with plenty of time for questions. I'd like to thank especially the top two people, Jessica Gibson and Dan Fessler at UCLA School of Public Health and Department of Anthropology. Their guidance has been very, very valuable. I'd also like to thank my colleagues in public health as they have really, really opened their minds and showed how willing they are to kind of receive this information and have this paradigm shift, and also inform me of how this information will best be received by people who are studying public health and planning on being public health practitioners. And thank you all very much for your time and for your attention.
Thank you, Emerald. We have time for some questions. Way back.
Thanks very much for your talk. You mentioned in your framework that you're addressing issues of inequality in an evolutionary framework, but I wonder if you also considered evolutionary explanations of diversity and the vulnerabilities of some populations to disease as a focus for teaching and discussion.
Can you clarify what type of vulnerability you're referring to?
Why do Indigenous people get high rates of diabetes, for example? That's the kind of example I'm thinking of.
So I'm not sure if I'm quite understanding your question. The model is designed to introduce public health practitioners to the problems that will be where an evolutionary perspective will be the most useful. And I think that it's after already a problem has been, there's been a decided problem and a decided target population. So I don't think I'm entirely clear on what your question is.
Joe, 1 second.
Yeah, so the example that the gentleman in the back brought up would be an example of evolutionary mismatch, which would be a problem for indigenous populations being exposed particularly to modern high-calorie, low-protein type diets. So there are numerous examples of that which we think contribute to health disparities and are going to continue to continue health disparities. So I think that's what he meant.
Other questions? Yes. Say your name.
My name is Steve Johnson. Just wondering, in most educational environments, there's a textbook support of some sort or other that will provide kind of guidance for the professionals in the field as they're being trained. Do you have any idea of how that might come about, or if there's something of that sort in the works?
I don't. That's a very good question, and I think that part of my efforts are to kind of create this introduction to evolutionary medicine for public health practitioners, because that's something that I have never seen. So I don't think that's in the works. I'd be surprised to find out that it was, and I'm hoping to be a part of that effort.
Good luck. It's great.
Thank you.
I think, oh yes. Excuse me, Joe.
Thank you. Could you say this EVMed PH roadmap tool, how exactly that will be implemented to help? Like, is this a resource that will be made available to people working on interventions, or what's the interface, especially to the people who aren't coming from evolution, you know?
Yeah, that's a very good question. I actually haven't fully made that decision yet. I don't know what program I'm going to use to create this tool. It's kind of still, this discussion's still being had. But my idea is that there will be a publication, and that link to this interactive tool will be made readily available, but also through other kind of educational and outreach endeavors to kind of spread the word that there is this tool. And it's kind of, in public health, there's a lot of this where someone has a new paradigm that they want people to view public health from. So it will be a little bit of a hard sell, I believe. I think it will be a hard thing for public health practitioners to use this tool and look at it. But I do think that the niche is there, and I think that with enough conversations and enough kind of collaboration that it can slowly trickle its way in.
Thank you.
Thank you.
It's a very nice presentation. I like that EVPH resource you're developing. I strongly recommend that you, or get somebody in your fielding school dean's office, send a note to the ASPH, Association of Schools of Public Health. They have a weekly news web alert. It's very informative. And there should be a news item about this session and your particular development. You don't have to wait till you have everything all done, but to rouse some other interest, such that when you come to meetings and your faculty and dean representatives go to meetings, this might become a major point of discussion. It's what's needed.
That's a
If you
great
want some help, I'll
suggestion.
be happy to. Gil Lohman.
Great, thank you.
Gil, you can help her make that happen? Make that connection? That'd be great. Thank you.
I'll look forward to that.
Echoing Steve Stearns' presentation and the one we'll hear later today about what is a patient and what is a disease, question for you to live in for a little bit is what is a population? And what does evolution have to teach us about what a population is as a way of building context? So thank you very much. Well done.